So in this video, I'm gonna talk about pulmonary embolism, right? So you must know because this is one of the most tested Nclex topic, and there are high chances that you will see a lot of question on your Nclex exam. So you must know about everything. Now let's start because maybe this video is gonna be a little bit lengthy, so we have to wrap up quickly. So first thing first, if I ask you, what's your good name? And if I ask you what's your nickname at home, so that's mean you are one person with two names, right? So same thing, that is a relationship between DVT and pulmonary embolism. So always remember that. What do you mean by that? What do I mean by that? So I will explain you everything. But if you have not watched the deep vein thrombosis video which I posted like 2 weeks ago, you must watch in order to understand the little bit of pulmonary embolism. Because what do I mean by that when I ask you your name and your nickname? So if I say that DVT is a good name and DVT nickname is pulmonary embolism, so what do I mean by that? So now I'm gonna explain you a little bit of DVT in order to understand the pulmonary embolism. So DVT, what is that meaning? So DVT means deep vein thrombosis. That is a blood disorder, a blood clot that is gonna form in your one of your leg, right? It's gonna form. It's called unilateral. It will happen only one side of the leg, and it will happen in your calf vein. So now, calf vein, right? So let's say if they say blood clot there, and once this blood clot break down, it will travel up here, and now it will, the DVT name is gonna change as a nickname, is gonna become as pulmonary embolism. So that's what I meaning to say. So real name is DVT, but the nickname is pulmonary embolism. Once it's cross upper part of your body, the name is gonna change as pulmonary embolism. Now this break now this so how your clot is gonna break down. So let's say if somebody is massage, or if you somebody applying heat, this blood clot is gonna break down from your legs, and it's gonna travel up, and it's gonna obstruct itself in the pulmonary artery. So when it's gonna struck in pulmonary artery, there is no oxygen or blood change, right? The lung will not exchange anything because there is a blockage there. So now in that situation, what's gonna happen? So patient is gonna be having, because there is no oxygenation exchange, so patient is gonna have shortness of breath. So in that situation, what you have to do now? You have to tell the patient to put them in high follower position and apply oxygenation. So that's the meaning of pulmonary embolism. Pretty simple. You just need to know the deep vein thrombosis name changes pulmonary embolism when it's cross up to your upper part of the body. So there are also three more types of embolism. One is air embolism, second is amniotic fluid embolism, and third is any foreign body embolism, which will struck in your pulmonary artery. So the main one is blood clot embolism, which we're gonna discuss. And also, let's say for blood clot embolism, you're gonna provide high Fowler position with oxygenation, right? But if on your exam, if they give you a question about air embolism, then then the patient position is gonna be left Trendelberg, which I will show it to you. Like this kind of position needs to be when the patient has air embolism. Remember that. So let's discuss about the risk factor. What are the risk factor of developing pulmonary embolism, right? So first thing first, the DVT is the key of developing pulmonary embolism. So DVT is the key of pulmonary embolism. Always remember that. Another thing is immobility. What do you mean by immobility? So that's mean when the patient has surgery, or if the patient has paralyzed or any bone fracture, or if they are laying in the bed for longer period of time, or if they are traveling in the aeroplane or in the car, or truck drivers, if they are sitting on same position, they are not moving their legs, that means there are high chances that they're going to develop deep vein thrombosis. So once the deep vein thrombosis build up, the problem gonna start. So right. Also pregnancy, that is another thing, because pregnancy, the female, they like to do bed rest, so that's called stasis. That's mean they are not moving like before, so there are chances they're gonna develop thrombus as well. Another thing you need to know is surgery, trauma, fracture, there are high chances that they're gonna develop blood clots. Also when the patient who has cancer, and if they are receiving chemotherapy, or patient receiving oral contraceptive, smoking, there are high chances that they could develop blood clots. Also, obesity, smoking, and age factor, there are high chances that patient could develop blood clots, right? So in that situation, what you have to tell to the patient? So you always have to tell to the patient after any surgery. That's why ambulation is very important. You have to tell the patient to help them to assist walking. So the more they walk, the more blood circulation they're gonna go up and down. So that's mean they're not gonna develop. Their chances are that they're not gonna develop blood clots. So that's why during your NCLEX exam, any question, any post surgery, you have to, what is the priority is ambulation. Remember that. The more they are bed bound, the more they're gonna stay in the bed, there are high chances that they're gonna develop clots. Now let's discuss about their sign and symptoms. So which sign and symptoms you will see in a patient with pulmonary embolism? So very importantly, you will see, of course, shortness of breath. That's the top priority. Shortness of breath is going to be sudden onset and it could be severe. That's the first thing you will see, right? Next, you will see chest pain. Chest pain is going to be sudden, and when the patient is going to take deep breath, it's going to be sudden and it's going to be worsen. So upon inhalation is going to feel sharp and it's going to be worse. So another third thing you will see is going to be tachycardia. So what is tachycardia means? Tachycardia means fast heartbeat. Like the normal heartbeat is like boom 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 boom, but in tachycardia is going to be boom 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 boom, like that. So that would be tachycardia. There is possibility that patient is gonna produce productive cough. What is productive cough means? That means the patient is gonna produce a blood tinge productive cough, and also leg swelling and pain if it's associated with deep vein thrombosis. So those are the symptoms you will see in patient with pulmonary embolism. But the main one you need to know is always shortness of breath. So when patient has shortness of breath, what's the first step you're gonna do? You're gonna always put them in a high follower position like this, and then you apply oxygen. That's the main thing you need to know for your Nclex. High follower position and apply oxygenation. Remember that. So next thing you need to know which diagnostic test the doctor is going to order. So first thing first, the doctor is going to order CTPA, CT scan of pulmonary angiography. That's the visual, it will see the clots. So CTPA, always remember that. If on your question, if you get that option, pick it immediately. Next thing, the doctor is going to order D-dimer test. It's a blood test which will see the possibility of if there is any blood clot already built up. The third is ventilation perfusion VQ scan. It will measure the amount of blood and air flow in your lungs. And this is only this they're gonna do only VQ scan if CTPA is contraindicated. So remember that if CTPA is contraindicated, then VQ scan is gonna be performed. Now let's discuss about the treatment plan. So which medication the patient is gonna be on, right? So patient immediately gonna start with anticoagulation medication, which are heparin and warfarin. Warfarin, another name is Coumadin, right? So when they start with heparin, if they are giving heparin, that is a first line of treatment. So if they are giving heparin via intravenous IV, always two nurse needs to verify the heparin dose, right? And patient is also also is going to be on Coumadin known as warfarin, right? So when patient is going to be on warfarin, they can given combine together because the heparin work fast and the warfarin is going to take few days to show its effect. So they're going to start combo together, but few days it will take for warfarin to adjust. Now the next thing you need to know, what is the next thing? So when patient is on heparin, what lab value you have to check? You have to check their APTT lab value. It should not be greater than 80 or it should not be less than 60. If it's greater than 80, that means the patient is on risk for bleeding. And if it's less than 60, that means the heparin is not effective. So the doctor needs to readjust the dose, right? Correct. Now let's discuss about warfarin. If the patient is on warfarin, what lab value you're gonna check? So in that situation, you're gonna check their INR lab value, right? So what is the normal range of INR? 2 to 3. It should be in between 2 to 3. And what you have to tell the patient when a patient is on warfarin? So you have to tell the patient to eat vitamin K diet consistently, consistent amount of vitamin K food. What is that meaning? So let's say if the patient is, you have to tell the patient whatever the diet you are eating, keep as it is. You don't need to add vitamin K rich food, or you don't have to drop vitamin K rich food. What is the reason? Because if the patient is eating consistent amount of vitamin K food, and if you start eating more vitamin K food, that's mean you have to know that what is the antidote of warfarin. So antidote of warfarin is vitamin K, right? Always remember Calvin Klein. So CK, right? Comodine, vitamin K. So if patient is eating vitamin K rich food, that means the patient is eating antidote. That means the warfarin is not going to be effective. So you have to tell the patient to eat consistent amount of vitamin K food, right? Another medication that you need to know, patient might be on thrombolytic medication. So what is thrombolytic medication? So that medication job is to dissolve or break down the cloth buster, also known as cloth buster. So Eclipse is the medication that you need to know for this one. Another thing you need to know, when patient is on heparin or and warfarin, these medication are given to prevent further formation of the blood clot, and also if there is blood clot already there, then it will help to prevent getting bigger. So that's the job of heparin and warfarin. Another thing, they could insert IVC filter. So what is IVC filter? IVC filter insert in inferior vena cava, and it will trap all the blood clots that is coming from the bottom. So it will trap all the filters. Another thing you need to know is patient is going to be on supporting measure. So what are supporting measures? So supporting measure means the patient is going to be on pain medication, oxygen, and fluid support. So that's the wrap of our pulmonary embolism topic. I know it's a little bit lengthy video, but it's only there to help you. And anytime you will see any question on pulmonary embolism, which tomorrow I will make a video where we're gonna do practice question and answer. And I am expecting that you will be getting all your answer correctly when you see any question on pulmonary embolism, whether it's tomorrow video, or whether it's in nursing school, or whether it's Nclex, or whether you world anywhere you're gonna do practice question and answer, you will be able to get your answer correctly on pulmonary embolism, right? Good luck.